Hi, we're here with Katie, and this is Dr. Rostami, and also Susie, my assistant, and we're trying to demonstrate a couple of things for patients that are afraid doing certain things. We wanted to make you feel more comfortable, see that how the process is done. It's very simple. One is we're going to inject neurotoxins for 3 areas. One is the glabellar area, which is the typical one they do. And then we're going to do the forehead, but I'm going to go over some of the things that could go wrong when you do the forehead, and you should be avoiding it. And we're going to do the crow's feet. If it's done very well, you're going to have a very nice, refreshing look in the upper face. To complement it, we're going to inject in the nasolabial fold, and she loves to have a little bit fuller lips, so we're going to do some injection in her lips. It's very simply done, and you'll see how easy it's going to be. We already have some numbing for her, so she'll be comfortable when we're doing the procedure. So I'm going to ask Susie to take off just the top numbing and leave the lower still on.
Okay.
By the way, we have done a couple of these things before, so you might have seen us doing these sort of things. So I'm going to just clean a little bit with alcohol. And I like to mark my patients. Some doctors don't mark patients, so that's their choice. But I like to do that. So I'm going to look at my patient, so you're going to see a little bit my back instead of seeing my face. So excuse me, but I have to look at my patient. Okay. So when I wanted to mark her, I will ask her to make the facial expressions. So I want you to bring it up. Yes, that's right. So this is how I want you to hold your eyebrow. To lift the eyebrow, we actually inject right near the eyebrow at the tail. That helps us to lift the eyebrow. So those are the areas we're going to inject. Katie, you okay?
Mm-hmm.
You let me know if you need a break, okay?
Mm-hmm.
I think these are pretty easy, aren't they?
Mm-hmm.
You already had some numbing, so it's pretty easily tolerated.
Mm-hmm.
Okay.
Mm-hmm.
Now, I know that some of you think that, oh wow, this is too many, but honestly, if you are pretty numb, it's not that difficult to tolerate it. So you think the numbing has helped?
Yeah, I feel it in more areas than some. I think next time I might want to be a little bit more numbed at the base of my hairline a little bit more.
Yeah, they didn't put it high enough. Oh.
But as far as the pain level, just if I feel anything, it's just a teeny pinch.
And the reason we picked Katie for this demonstration is because Katie never done this before. So this is a new thing for her as well. So it might be new for some of you guys out there. So I wanted her to tell you her experience, so how she feels about the whole process. We didn't coach her, so this is a true thing.
This is all
yeah, this is what
live.
Yes. And we will have before and after pictures of Katie in a few days, because you know it takes a few days for the neurotoxins to work. The name is horrible. I hate that neurotoxin. You know, it's toxin. So, but anyway, the effect of it is going to show probably in a few days. So it's not obvious right now. So that's why we're going to have some before and after pictures of Katie when she's settled, okay? So now we're going to go ahead and concentrate a little bit on your nasolabial fold, not the lips yet. So, and what I'm using for the nasolabial fold is Bellaterra. Bellaterra is more for the fine wrinkles, but because Katie is young and she really doesn't have that much to really treat, so we're going to use something that is more gentle and more softer. So this is what we're going to use for her. You okay? Mm-hmm. That's for this side. I'm going to concentrate on the other side now. I wanted to show this area. See how softer this area became compared to this one now when I'm injecting. So now we're going to do the same here. You okay? A little bit right here. Mm-hmm. Very little, okay? Okay. Mm-hmm. We always can add more, so if you thought that this is not enough, we can add more to it, okay? Especially this is your first time, I don't want to.
That's a perfect amount of the first time.
So this finalized our presentation for today. So we did the neurotoxin, we did a little bit of a nasolabial fold, and we did the lips. And we didn't do much in the lips, or it was only 1 vial, so which is 1 ml of the product. So it settles very easily within a couple of days. She really didn't get much of a bruising or anything. So it's just a little bit of a swelling, and that comes with those products. It's just they are water, they attract water, they're water attractors, and they bring water to the area. For that's just the first few hours, and then it gets better as the time goes, and that's why we recommend to have ice on the area. And that's it. Okay? Thank you.